Hi, everyone. Welcome to this video. I'm excited to be sharing this video because I've got a colleague and friend here, Sarah Moran, who's going to be chatting with me. We're going to be chatting together. Licensed marriage family therapist and registered play therapist. Woo! We love our play therapists.
And certified AutPlay therapist.
And certified AutPlay therapist. How could I forget that? I should lead with that. See, I'm a bad marketer. But we're going to talk about something specific in this video, and that is a book that I was working on for seemed like quite a few months that recently came out. This book right here, Understanding Sensory Differences, Neurodiversity Affirming Guidebook for Children and Teens. And Sarah, you contributed to this book. There were several contributions from professionals. I think most of them were play therapists or mental health professionals who identify, like me, as being sensory different or having sensory processing disorder or needs, etc. However somebody wants to use the terminology. And we're just really shared in the book our lived experience. And so let's start with that, because I love what you shared in the book. Two things jumped out at me, so we'll take them one at a time.
Okay.
The first one was, I think you did this amazing job of capturing what it's like on the daily, like as you just navigate normal daily life things, what it's like when you have sensory differences. And were you going for that?
I think I started writing about, I think the things that first came to mind were things that I now know are sensory differences that I can see were occurring in my childhood that I didn't have words for at the time. And those are the first things that always come to mind, is like, I'm a sensory seeking kiddo. And the more I thought about those old things, I'm like, oh, but they didn't go away, right? Like they're still here. And I've just had to learn how to be an adult that also wants to do those things and figure out how to navigate that, not only in like my work life, which I think is easier as a play therapist to be able to just be like, also, I'm just gonna sit on this crash pad all day. And, but also in my personal life and in my social life, and just noticing the ways that sometimes I can just get very overstimulated in my environment, and I need to like do something to get myself like back to a regulated state to keep being in that state.
Absolutely. I will say to everybody who's watching this, obviously, I think this is a great book. And if you're a professional or parent and you're working with kids who have sensory differences, this is an important book to have on your bookshelf and to access and read and maybe reread and utilize. But if for no other reason, read Sarah's contribution, because I think it's so important that people understand just how it affects you just through normal daily things that other people who maybe don't have sensory differences think are just things that are no big deal, you know, and
or things that
go ahead.
Or things that feel like a weird fear. Like I know that like the hiking example, like I know that is talked about every time I go hiking with friends, where they're like, why are you so scared on the way down? And I'm like, because my body does not trust my feet, okay? And I will fall.
Yes.
Like that feels like it reads to other people as like a weird fear or something silly. And also it's like all encompassing. When I'm going downhill, I'm like, I will fall. When is it happening?
Yes. I mean, they're just, you have so many of these little kind of vignettes in your story of just like day-to-day typical things that somebody might be doing, and how you understand your sensory system in regard to these things and what's going to come up for you, or what you need to do, or what you're going to do. And that's such a good thing for, I think, parents and professionals to read and understand, because it isn't always a giant sensory related meltdown. That's still a struggle or a need, right?
Yeah. It comes up more often in small ways. And I think, especially for parents, that I try to help parents understand with their kids is that they are working hard to meet that need all the time. And you're just not always noticing how they are trying to meet that need. And
Yeah.
sometimes you see it because they're trying to meet that need in a big way or in an unsafe way, but probably they've tried a lot of other things to meet that need before they got to the big thing or the unsafe thing.
Yes. And that is almost sensory education 101 to people, I think, who don't have any sensory needs or differences, is, it's hard sometimes for them to understand, what could be causing an issue for a person who does, because they may be navigating something or doing something, the same thing, or walking into the same room or going down the same hill and being like, I don't see what your problem is because I'm not experiencing anything, right?
Right.
And it's like, yes, that's part of the problem. You have to understand, the neurodifference here, because you're not going to experience that. But this child is, to a great deal. And you have to understand that. Or so many things can just go really the wrong direction for the child.
Mm-hmm. Sometimes I give parents the example of like, if you hear a car alarm, you might have a moment of panic of like, oh, is that my car? And then you're like, no, it's not my car. Like, you can apply logic to it. You're like, it's not coming from the right direction. It doesn't sound like my car alarm. But you have that moment of like hypervigilance of like, what is my car? And then it goes away. And I'm like, but imagine feeling like you heard a noise and you get that sense of like urgency, and then that the sound might go away, but the urgency doesn't go away. And so then you are walking through your existence of just like, I am in a sense of urgency and I can't bring myself back down, even though the sound has disappeared. And like for so many kids, especially ones who have like complex sensory challenges, it's like that feeling of anxiety or urgency is present, even if the sensory thing has left, right? Even if the input has left. And parents are like, but it's gone. They should calm down. It's fine now.
Right.
It's not fine now. Their body is telling them it's not fine now. Their body is still on high alert.
Yes.
And I find parents can like identify with that car alarm analogy because they're like, that happens to everybody. And I think sound is one sense in particular that parents can identify how frustrating that is if sound is bothering them. And I'm like, great, now apply that to all the other senses.
I like that you, give an example that makes it understandable, for the parent, something they can relate to, and then it's not so far for them to take it further and start to go, okay, I can understand my child and their sensory system, their sensory differences, and really get this, and have the empathy I need, and also the understanding to provide support, that the child is going to need most definitely from their parents, for sure.
Yeah. I find that I have to do a lot of psychoed about sensory with parents, even parents whose children have been in all kinds of services, because I don't think consistently that all occupational therapists have been explaining what they are doing exactly with children. I am fortunate that we work with a wonderful group of occupational therapists in our area. And, but I've met several families who are like, my kid's been in OT for years and I don't know any of this information. I'm like, well, this would be helpful to know why you're doing what you're doing.
Yes.
And talking to parents of like, we actually all have sensory preferences. It is what determines how we dress and what foods we eat and how we know if we're warm or cold or what we feel generally comfortable wearing and doing. And I'm like, and we don't all have sensory preferences that impact our lives to the extent that we have to pay attention to them. But you certainly are doing things in your daily life because of your sensory preferences. Yeah. And parents are very quick to notice of like, I don't like wool blankets, so we don't have any in the house. So now when kid goes to grandma's house and they're under a wool blanket, they like can't tolerate it. And they're like, did I do that? And I'm like, yeah, I mean, maybe if they've had no exposure to wool, like maybe.
Right.
But you didn't see that like that's a sensory preference. So you didn't have it in your house because of something that you feel uncomfortable in your body. And now everybody feels uncomfortable about that thing.
It's one of the biggest areas of education I think I run into, because I've just seen so often through the years how sensory needs are so misunderstood and hard, I think, for people sometimes to grasp if they're not really challenged by them or have needs. It's just really hard because, again, I think, they're just going off of their own perception in the same environment. Mm-hmm. And their perception is telling them everything is fine. So then everything must be fine, for everybody. And it's just getting past that.
Yeah.
And then
a privileged position to be in. I think everybody's living life just fine, just like you are.
Yeah. This room is great. It's actually relaxing. So it must be relaxing, for everybody. It's always fun to kind of, even as an adult, get into those moments and for me to go, well, actually, let me kind of share with you that they're not really relaxing for me because of this and this and this. But I get that it's relaxing for you, but it's good to understand that your perception of it and the way your system is operating here may not be the same for everybody else.
Yeah. And really reassuring. It was like, I am managing myself in this space that you feel is comfortable. And I don't feel like it's comfortable, but it's not so uncomfortable that I can't function in it. Right. Like there is like a wiggle room there, but I'm also an adult who's like cognitively walking myself through things that are uncomfortable too.
Yes.
And not all kids can do that.
That's right. Very different. A lot of times kids that come in to see me don't even know what sensory differences are. I mean, they've never been talked to about this. They don't even understand what's happening in their own body. They have no terms for it. They have no understanding of it. It's probably just very dysregulating and scary for them. And that's very different than an adult like you or I, who are capable of writing about this and understand our systems at this point and know how to take care of ourselves to some degree. And I think very different, right? And remembering that about kids and not putting these expectations on them that are very unrealistic, and we could even argue are ableist.
Absolutely.
Yeah. Well, number two thing I really like about your contribution, I could say more than two, but two big things stand out. Number two, and we were talking about this before the video started, is just the way you write and how you write about your sensory lived life. It's just so empowering. It's just so like natural and matter of fact of, this is who I am and this is how this works and this is how I do this in this situation. And that's that wonderful affirming piece and that affirming quality or atmosphere that you've got going in your writing contribution.
Mm-hmm. I feel like that's so important especially for child-centered play therapists. I often have this discussion with my colleagues of just, I can't understand how child-centered play therapists can't be neurodiversity affirming, because we are child affirming, right? We meet children on their level and we are being with, and that is exactly what that means to be affirming to neurodivergency, is like seeing you for your strengths and focusing on your strengths and also what your challenges are and being with you in that space. That is a hard concept though, I think, for still a lot of therapists, and a lot of therapists who are maybe afraid of working with neurodivergent kids, when I think a baseline is we need to understand our sensory systems more, right?
Yeah.
Also, you and I, we know that your sensory systems are important to know, even if you're not neurodivergent, right? It impacts anxiety too, right? All the other things that we work with, trauma.
Yes, yes. Well, you know, I mean, we're focusing on sensory differences in this guidebook, but we're talking about being neurodivergent in this guidebook coming from a sensory different place, but across all neurodivergence, whether it's an autistic child or sensory different or ADHD or whatever it might be. Yeah, I mean, I think, you know, as mental health professionals, especially play therapists, let's be leaders. Let's lead out in normalizing neurodivergence. You know, let's be on the forefront of that, not the back end trying to catch up, right? And making sure that we are putting forth these principles in our playroom, in our therapy, but also educating and advocating for in the neurodiversity movement. I think what you said is absolutely true, that we just need to take that on as play therapists, every play therapist, because every play therapist out there who's working with kids for sure, and most of them do work with kids, is working with neurodivergent kids. I guarantee it. And so just getting this understanding and then being pro advocacy in this way, in the playroom and outside of the playroom, it would just be huge.
Absolutely. And absolutely, parents pick up on that. They pick up on that very quickly if you are comfortable around their child or not.
Yes.
And like how comfortable you are talking about sensory or how comfortable you are talking about neurodivergence is, I feel like what parents have most reported to me that didn't work with therapists that they've had in the past is that they're like, okay, well, like you are talking about it with us instead of shying away from the thing or talking about all of these other things about their child that is like trying to avoid the strengths or challenges of the neurodivergency. And I'm like, that doesn't make any sense. Like, how are we compartmentalizing the, compartmentalizing the neurodivergent parts of a child from the rest of the child? That doesn't make any sense.
Right. Well, there's definitely work to be done, and just you know, even in play therapy, which, like you said, I think in general, because of that idea that so permeates play therapy, all play therapy theories, that we're affirming of children, we get quite a bit further down the road, even toward neurodiversity affirming. But it isn't enough just to be affirming of children in a traditional play therapy way. We got to take that extra step to understand how to be neurodiversity affirming with neurodivergent children. And it is getting better, but still progress to be made. And I think what's great about like your contribution in this book and many of the contributors, again, who were mental health professionals, play therapists, even just you guys sharing your stories and your lived experience, I think that's huge at helping other play therapists go, oh, okay, I need to get this. I need to understand this better.
Yeah.
This needs to be more what I do.
Yeah. And reading everyone's perspective, or like to call it a little sensory memoir, is like, it just comes up. It's like so many day-to-day things that happen that are explained through a sensory lens. And that's true across everyone who contributed. Is just like how they tolerate food, or how they tolerate like certain textures, right? It's like all through a sensory lens. And I think that anyone reading it who maybe doesn't even identify their own sensory challenges can see that it happens all the time with everything that you do and interact with in the world.
So true. Very well said. And again, I'm highlighting our guidebook here, Understanding Sensory Differences, which obviously, you know, you can pick up online all over the place, and highly recommend it. Besides all these great contributions like Sarah's and mine, there's a lot of other information about how to be neurodiversity affirming with sensory differences, what that means. And also lots of guide sheets, worksheets that you can use with kids to help them understand what this means, help them understand their sensory differences from an affirming, empowering, strengths-based perspective, which is huge. I write about that a little bit in my story, but one of the big changing points for me was like finally understanding my system from a non-judgmental way. That was a huge turning point for me. And I think if we can get kids in that place as kids, I got that as an adult. If we can get kids in that place as kids, that's huge for them moving forward.
Absolutely. I think so much of that is also getting parents to see that sort of like that two sides of the same coin, sensory versus behavior. I think that is very reassuring to parents when they can put explanation to why their kids are doing certain things to a sensory reason and not like they're being a behavior problem, which is often what schools are reporting, right? The reason that kids are coming to therapy. And I can see so much relief in parents when I'm like, I absolutely do not see that your kid has any intent to harm. They're not trying to hurt anyone, but they are trying to meet a need, and they absolutely don't know where their body is in space, and they absolutely don't know how to meet that need safely in their environment.
Yeah.
So how are we going to help them meet that need safely without shaming them?
Absolutely. I am going to let you have that last final word because it was very well said. And I just want to encourage anybody watching this video to take a deeper dive. You know, even if it's just not this guidebook that you get, go read more about sensory needs, working with sensory differences in the playroom. There's lots of people who train on this in play therapy. And so go to a training, get more books and learn more. So, and more about being neurodiversity affirming. There's a lot of information out there that you can get on that topic too. Just invest because it is worth it. This is what you want to know to be your best play therapist for these kids when they come in to see you. So thank you, Sarah, for sharing with us.
Absolutely.
And thank you guys for watching. And obviously, please consider liking our video and subscribing to the AutPlay Therapy YouTube channel. And come back, watch more. Maybe Sarah will come back and talk to us again anytime she can. Take care, everyone. Bye.